The term corona blue is a combined word of coronavirus and blue meaning depression. People who feel negative emotions such as depression and anger due to coronavirus are often found around them. This has also raised social issues. Students who can't go to school, office workers who have been fired from their jobs, small business owners who can't operate, etc. There is a situation where one can't help but be depressed. However, experts argue that this will continue even after the coronavirus pandemic is over. A research team led by Michael Zvolensky, a psychology professor at the University of Houston, said that even after the coronavirus pandemic's negative effects on mental health could continue for years. Even if vaccines or treatments are developed and coronavirus pandemics are ended, people's minds will not recover easily. Professor Michael Zvolensky said, "The mental health problems that COVID-19 has caused will not be erased even if we get vaccinated. It's something that we have to go through for generations." To support the claim, the team surveyed 160 participants for a link between COVID-19 and drug addiction. The research team evaluated the health condition and level of drug addiction before and after COVID-19. The results showed that psychological changes caused by COVID-19 increased motivation to access addictive substances such as alcohol, tobacco, e-cigarettes and marijuana. In particular, excessive worry over COVID-19 has raised the risk of drug addiction. The findings were recently published in the journal Psychiatry Research. The problem is that even before COVID-19, the mental health of mankind was already in a serious situation. Before the coronavirus pandemics, the risk of mental illness and addiction has increased by 50% in the last 25 years, said Professor Vikram Patel of Harvard Medical School at the conference on coronavirus, which was held on the 23rd of September. 1 in 10 people in the world suffers from mental illness and the suicide rate is increasing in many countries. Professor Patel went on to say, "We need to look at the coronavirus pandemics from the perspective of diagnosis, drugs and treatment to the impact on mental health. The spread of COVID-19 has not yet been completely completed, and thorough quarantine and treatment development are of course important. However, it seems necessary to take proactive measures to prevent mental illness from becoming a second pandemic. Failure to do so could lead to more serious social problems, just as the suicide rate has soared since the 2008 U.S. economic crisis. In addition to world's government's effort to ease such problems, it is also necessary to come up with national-level management guidelines, including a survey of the state of mental health for the entire nation."